Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Do you know what venereal warts are and how they can affect you? Let's dive into this topic. Venereal warts, also known as genital warts, are a sexually transmitted infection caused by certain strains of the human papillomavirus, or HPV. It's a common condition, making it crucial for everyone to understand. By knowing about venereal warts, we can better comprehend their impact on our health, relationships, and overall well-being. Knowledge about venereal warts can help in prevention and early treatment. So, let's get informed. So, what causes venereal warts? The primary culprit behind venereal warts is a virus known as the human papillomavirus, or HPV. This virus is responsible for a variety of skin and mucous membrane conditions, venereal warts being one of them. The transmission of HPV mainly happens through sexual contact, making venereal warts a sexually transmitted infection. However, it's not just about sex. There are risk factors that can increase your likelihood of contracting the virus. If you have multiple sexual partners, your chances of coming into contact with HPV rise. A weakened immune system can also leave you more susceptible to the virus, as it struggles to fight off infections. And if you have damaged skin in the genital area, it can provide an easy access point for the virus to enter your body. Remember, anyone who is sexually active can get HPV and therefore venereal warts. What are the signs and symptoms of venereal warts, you might wonder? Well, let's dive into it. The most common sign of this condition is the presence of small, flesh-colored or grey swellings in your genital area. These growths may be raised or flat, single or multiple, small or large, and sometimes they even take on a cauliflower-like appearance. Now, apart from the visible warts, you may also experience symptoms like itching, burning or discomfort in the genital area. In some cases, venereal warts can even cause bleeding during intercourse. One important thing to note is that these symptoms may not show up right away. It can take several weeks or even months after having sexual contact with an infected person for the signs to become apparent. So if you notice any of these symptoms, or if you've had unprotected sex and are concerned, don't hesitate. If you notice any of these symptoms, it's important to seek medical advice. How are venereal warts diagnosed and treated? Well, the process begins with a thorough physical examination. Healthcare professionals often can identify these warts simply by their characteristic appearance. However, in some instances, a biopsy might be necessary. This involves taking a small sample of the wart tissue and examining it under a microscope to confirm the diagnosis. Once diagnosed, there are several treatment options. One of the most common is the use of prescription creams or ointments. These medications are applied directly to the wart, causing it to gradually shrink and eventually disappear. However, this method requires discipline and patience, as the treatment often takes several weeks to show results. Another option is cryotherapy, a procedure that uses extreme cold to destroy the wart. In some cases, healthcare professionals may opt for surgical removal, particularly for larger or persistent warts. This procedure is usually quick and effective, but it can sometimes lead to scarring. Lastly, laser treatment, which uses a strong beam of light to destroy the wart tissue, may be used in certain circumstances. Regardless of the chosen treatment method, it's important to remember that these are all designed to manage the symptoms, not cure the virus. Regular checkups are crucial to monitor the condition, prevent complications, and reduce the risk of transmission to others. While treatment can help manage symptoms and reduce the risk of transmission, it doesn't cure the virus. How can we prevent venereal warts, you ask? Well, there are several effective strategies to help keep you protected. Firstly, practicing safe sex is crucial. Using condoms can significantly reduce your risk, but remember, they don't provide complete protection. The virus can infect areas not covered by a condom. Secondly, being faithful in a relationship or limiting the number of sexual partners can also help in reducing exposure to HPV, the main culprit behind venereal warts. Another key preventive measure is vaccination, specifically the HPV vaccine. It's recommended for both males and females and can protect against the most common types of HPV that cause venereal warts. Lastly, don't underestimate the importance of regular health checks, particularly if you're sexually active. Early detection can lead to more effective treatment and can prevent complications. Remember, knowledge is your best defense. Prevention is always better than cure. Stay informed, stay safe. UMCC, your ultimate medical consultant connectors.